When can I do the advanced course? We get that asked so much when we're doing the Ultimate Aesthetics course, our foundation. By the end of your course, you're ready and raring to go and you're really excited to do your advanced treatments. Your insurance does stipulate that you need to have been practicing your foundation treatments for 6 months in order to be insurable for your advanced treatments. However, you can carry it out sooner. Just make sure that you are confident in all of your foundation treatments to come onto the course. However, you just won't be insured to carry out the treatments until you've been practicing and insured for 6 months. What are the signs of a vascular occlusion? Again, this is something that we get asked loads and loads because lots of people obviously and correctly are concerned about causing a vascular occlusion and making sure that they spot it at the most appropriate time. The easiest way to answer this is your client in an awful lot of pain? Are they intolerable to you touching them? Does the area look pale? So press down on it, press down for 5 seconds. The colour should come back within 2 seconds. If it doesn't, then there's sluggish cap refill and therefore there probably is a little bit of an occlusion. If it's cold to the touch, it means there's less blood flow getting there, so therefore the signs of a vascular occlusion. Has it been left for a little while and is it tracking along the face? That would mean that there's a build-up of blood that's not able to get through the vein or the artery, and therefore that again would be a sign of a vascular occlusion. If you did suspect your client had a vascular occlusion, you would then move on to your emergency dissolving protocol. What if somebody is allergic to lidocaine? That's absolutely fine. If your client's allergic to lidocaine and they want to come in for some lip fillers, you can buy lip fillers that don't have lidocaine in them, so they don't have the numbing agent. Be very wary of that so that they might not feel comfortable sitting through their appointments because it can be quite painful to have the lips done without the lidocaine. They also wouldn't be able to have the numbing cream applied either because that does have lidocaine, which is the numbing agent in the cream. If somebody was to have an allergic reaction to the lidocaine whilst you were treating them and you went into anaphylaxis, you get your emergency pack out and you would administer the adrenaline whilst calling 999 and following all of their instructions. I trained with the brand Allergic, but it's now out of stock. What can I do? Again, we've had this quite a lot recently. It doesn't matter the product that you trained with on your courses, you are certified to use any of the toxin treatments for your clients. So you can use the other brands such as the Allergic or you can use Botox. If you've done your course with us, in your manuals, it does have a nice step-by-step guide in how you can mix up the product and the units in which you can do to inject your clients as well in there. It is very similar to using the Allergic once you've mixed it up. So you can always ask us as well for more help, but don't worry, you are able to buy the other brands of the Botox. Should I always take before and after pics? Absolutely. So not only is it good for your social medias to be able to show before and after pictures for your clients so they can see your work, it's actually legally required by your insurance. If somebody was to come to you and say that you've caused them to have asymmetries somewhere on their face after doing a treatment and you haven't got a before and after picture to say actually there was already some asymmetry there, then unfortunately your insurance won't help you. You do need to make sure you've got those and they are attached to your client records. Can I stop all clients from bruising? Unfortunately not. Bruising is a fact of life if you're going to be having aesthetics treatments. You're placing a needle into the skin and unfortunately we can't see where all of the vessels are. So therefore 8 in 10 clients will come away with some bruising within the next 2 weeks from their treatments. You can prevent bruising by asking your clients not to have any alcohol for the 48 hours before or after their appointments. Also, drinking coffee can make your blood thinner, so therefore if they reduce their caffeine intake beforehand, that will prevent some bruising as well. Unfortunately, some clients are taking medications which does thin their blood, so therefore they may be more susceptible to bruising. You can take arnica tablets, which clients can buy from the pharmacy over the counter, which they can take for a couple of days beforehand and for around 3 or 4 days after their treatments. That can help to reduce the bruising. It is a herbal remedy and they can also use arnica gel as well.